Good morning everyone. Today we will talk about the asthma. Asthma is a respiratory problem. The person is suffering from asthma feels shortness of breathing, difficulty in breathing, coughing, sneezing, and also it sounds like whistle when sleeping. We are studying about the yoga and lifestyle. So here in this lecture we will talk about the asthma, its effect and how we can have a control on it through the different yogasanas like Sukhasana, Prabhatasana, Chakrasasana and so on. Before knowing the asana and its effect, I would like to show you one video of 3D representation of physiology of asthma. And after that we will talk about the effect of the exercise and yogasanas on the asthmatic patient. So let us proceed. Here we can see a normal airways and the breathe in and breathe out is taking place. Here you can see some kind of patches are there. The wall of this airways windpipe is normal and the person is normally breathing and breathe out. Later on we will see that gradually these things and the wall of the airways are being thicker and thicker. And here you can see the readiness inside it. The band of the airways are tightened, and also it is making some obstacle to breathe in and breathe out. So this is the whole physiology of the asthma. Here you can see how it was and after asthmatic effect, how it is thick. Before this, it was a bit thin and also it was having more space to breathe in and breathe out. Here we can see the Sukhasana, the easy sitting pose. Sukhasana easy pose, descent pose or pleasant pose is an asana. It is a basic of all the asanas. Sukhasana comes from the Sanskrit word sukham, which means easy, pleasure or comfort. People of all ages can practice this asana. It is a meditative pose, so it is the best if you practice this asana in the morning. But if you are practicing it in other than the morning, it may give you some kind of pleasure, but the benefits will be minimized. How we can perform these asanas? It is very easy to sit, stretch your both leg. After that, close it from the knees. Sit in a normal posture and put your both hand on your knees. A bit erection must be there from the elbow. The backbone, neck, and the whole body posture must be erected. As much as it is possible to be practiced, the duration of the Sukhasana will be increased. What kind of benefit we can take through the Sukhasana in asthma? It relaxes the brain. It gives broadness to the chest and the collarbone. The body alignment improves. If the knees and hips are injured, we should avoid it. The second asana is Chakrasana. It is a strong back bending yoga asana. Chakra means wheel and asana means posture. So in this, we have to make our body as a wheel. This asana must be performed only when your stomach and belly is empty. It is best to have a meal at least 4 to 6 hours before you practice these asanas. Simply we have to lay down on the floor from the back. We have to close our both heel with the buttock. We should put our both hand back just near the ears, and very slowly we should erect our body up, and we should try to go in the position of Chakrasana. It cures infertility, asthma and osteoporosis. It is good for the female. It also helpful in the back pain, kidney problem. It prevents hernia. It also stimulates thyroid and pituitary glands. It decreases the stress and depression. Few contradictions are there. It is best to avoid this asana if you have any problem in your wrist or carpal. Lower back problem, person should also not perform it. Shoulder problem or alignment problem, person should not also perform it. And don't practice this asana if you are suffering from headache or high blood pressure. The third asana is Gamakasana. As name spells, its meaning means we should be in the posture and put our leg like Gomukha, cow face. This posture helps to open your shoulder joints, and it's give a wideness to the chest, shoulder and the knees. It is a great pose for the athletes to test their ability to stay tough in difficult situations. This asana can give us the range of movement in our joints. It strengthens our spines and abdominal muscles. If a person is having serious neck or shoulder problem, if the lady is pregnant, and if serious knee problems are there, the person must not perform this activity. Now we are seeing the Prabhatasana, mountain pose. Sit in Vajrasana pose and keep your spine and neck straight, and also you can sit in a normal Padmasana pose, and we have to put our both hands up in Namaskar Mudra. Prabhatasana is also preferred to do in asthma. It prevents the anxiety, respiratory problems. It gives a space to the diaphragm and lungs to have more and more air. If the person is having wrist, hip or ankle injury, must avoid it. Next asana is Matasana, fish pose. Matasya, that means fish. Asana, that means posture. We should first sit in the cross leg position, Sukhasana or Padmasana. We should sleep in the same pose on the bed or the asana platform, and finally we should turn our neck up and we should put the head up. This asana strengthens the respiratory system as it gives much space to have air inside it. It also activates the thyroid glands. It also stimulates the kidney function. This asana should be avoided after any abdominal surgery, and also the hernia patient must not perform it. Also, we should avoid this asana if we suffer from problems of the cervical spine, high blood pressure or dizziness. So my dear students, here we have discussed about the asthma, its effects, sign and symptoms, the physiology and the asanas which can have a control or check on the asthma. I hope this video is
Hopefully this video is fruitful for you, and all the related questions you will solve, like what do you mean by asthma, what is the physiology of asthma, and explain the diseases which a person can perform to control the asanas. So we will very soon meet with the next video. Till then, goodbye. Thank you. May God bless you.